Welcome to the East Carolina University Brody School of Medicine Combined Internal Medicine Pediatrics Clinic. My name is Lacey Hobgood and I am the Medical Director of the Adult and Pediatric Healthcare Clinic and Division Chief of Internal Medicine Pediatrics. I would like to share with you some details about our clinic and talk about your opportunity to work in our Combined Internal Medicine Pediatrics Clinic. Every combined training program must provide a longitudinal clinic experience to its residents. Many programs have you alternate between an internal medicine clinic and a pediatric clinic. Some programs do have a combined clinic that is open on a part-time basis. A distinguishing feature of our training program is that our combined clinic is open all day, Monday through Friday. Each resident will come to clinic one afternoon per week, assuming you are not working in an intensive care unit at night or certain other inpatient rotations that have a more demanding daily schedule. Our goal is for you to see both children and adults in every clinic session. On your very first clinic session, you will have one pediatric patient and one adult patient. And once you have become familiar with the logistics of working in the clinic and using the electronic health record, we increase the number of patients on the schedule. Experienced interns will have 2 adult and 2 pediatric patients scheduled ahead, while upper year residents will have 4 adult patients and 4 pediatric patients scheduled ahead. We also will have 1 same-day visit slot that can be used for acute access, such as acute illness, hospital discharge follow-up, or newborn nursery follow-up. We run the resident continuity clinic in the afternoons, Monday through Thursday. You will be assigned to a particular afternoon, and the overwhelming majority of the time, you will be in clinic that same afternoon, working with the same residents and nurses, taking care of the same patients. We want you to develop longitudinal relationships with your patients and their families so that you can see how the children grow up, how disease conditions improve or progress, and learn how to manage problems over time. You will have the ability to look ahead at your schedule to know who is coming in, review what conditions your patients have, think and study about their conditions, and develop appropriate treatment plans. Now, like any other safety net clinic, there will be cancellations and no-shows. And we will use those times to build in more acute access visits. So you will learn how to evaluate and treat acute illness while also providing wellness care, chronic disease management care to patients of all ages. There will be times that you will not be able to be in clinic yourself. And when that happens, your patients will need to be seen by one of your resident partners from the same afternoon group. For example, you might be assigned to the Tuesday afternoon clinic group, and during resident block 3, you work as an intern in the medical ICU and therefore will not have clinic. During those 4 weeks, your patients would need to be seen by one of the other Tuesday afternoon residents. The following block, you might be doing an ambulatory rotation and have clinic every week, while your resident partner is working in the intensive care unit. And so you might need to see one of their patients. We try to have patients seen by the same doctors who work the same days to maintain consistency and familiarity and maintain longitudinal relationships of care. This also applies to the supervising attendings. When they are directly supervising you in your continuity clinic session or working in the hospital themselves, they are not seeing their own patients in the clinic. So every so often, you might see one of your supervising attending's patients when you have an opening on your schedule. Because our clinic serves as the faculty's private clinic, in addition to being a safety net teaching clinic, that adds significantly to overall patient diversity. You will see patients who are uninsured or have government-funded insurance such as Medicaid and Medicare. Many of these patients have significant chronic health care needs. Because there are a number of military installations in eastern North Carolina, you will see service members and their families who are covered by TRICARE. You will also see many privately insured patients, hospital employees, university students, faculty, staff, and patients covered by standard private insurance. Having the opportunity to see patients of diverse backgrounds from a broad range of socioeconomic status and determinants of health leads to a rich clinical learning environment. You will see patients of all ages from all walks of life during your continuity clinic experience. Our clinic is an advanced medical home, and it follows a system of graduated responsibility. When you are a new intern, every patient that you see will also be evaluated by a faculty member. We will be right there with you, guiding you through the process, making sure that everything that needs to be done for your patient is being done. As you gain experience, the attendings will give you a bit more independence both during visits and between visits. You have been assigned a panel of patients, and there are things that happen in between the face-to-face visits, such as patients asking questions over the telephone or through the chart's patient portal, or having test results returned and needing to explain to a patient whether their lab results or imaging studies are normal or expected for their condition, or abnormal or unexpected, and if so, whether a change in the treatment plan needs to be made. We do expect you to learn to answer these questions. You will always have backup. As an intern, you can always turn to your senior residents with questions, followed by your primary clinic precepting attending, and ultimately, any question or concern that cannot be answered by anybody else will be managed by me as your clinic's medical director. By the time you are in your 4th year of residency, I expect you to be able to practice patient-centered, evidence-based medical care of children and adults, managing all aspects of their primary medical care. That is what we will teach you in your longitudinal clinic. Now, at this point, some of you may be thinking, that sounds fantastic, but I don't want to be a clinic doctor. I want to be a hospitalist. Or some of you might be thinking, I know I don't want to do primary care. I plan to subspecialize. Regardless, there are other skills that we will teach you in the clinic that you can use regardless of your future career path. First, every physician in our clinic participates in quality improvement work. Each resident practice firm plans and implements its own quality improvement project every year. Plus, several of our faculty members serve as mentors to distinction track medical students who also are learning how to design, lead, and execute quality improvement work. So it's not unusual for our residents to participate in multiple quality improvement projects. You will learn how to write aim statements, develop SMART goals, perform process mapping and fishbone analysis, work in interdisciplinary teams, and present your work to others. Our quality improvement work is presented internally to our own clinic and also every year at our hospital systems quality improvement symposium. Our residents have also presented their work at state and national meetings. Second, every physician in our clinic learns to work within an interdisciplinary team. We have staff nurses who manage many aspects of care and nurse specialists who focus on certain high-touch, high-needs patients. We have a transition nurse specialist who focuses on young adult survivors of complex childhood conditions such as congenital heart disease, neurofibromatosis, spina bifida, sickle cell disease, and cerebral palsy leading to technology dependence such as enteral feeding or tracheostomy. We have an adolescent nurse specialist who focuses on common adolescent needs such as sexually transmitted infection screening and treatment, eating disorders, and mental and behavioral health. We have a health coach who focuses on chronic disease management, including patient education and closure of patient care gaps. Our clinic has a medical nutritionist who can perform education and support for common conditions such as diabetes mellitus and hypertension, or help with counseling for weight loss, and who also helps with management of enteral feedings. Our clinic has a social worker who can help address unmet socioeconomic needs. We also have a clinical pharmacist who herself is a preceptor for pharmacy students who can assist with medication reconciliation, access pharmacy dispensing records, and provide prescription advice. Third, every resident physician will learn about the logistics of billing and coding. During my time as medical director, the rules for billing and coding have changed, but we make sure that our residents know the system as it currently stands and prepare our graduates for change as healthcare continues to move from a fee-for-service model to a pay-for-performance accountable care model. Finally, we are proud to be a teaching clinic. At its core, the term doctor is derived from the Latin docere, meaning to teach, instruct, or point out. As an intern, you expect to be taught by your attendings and senior residents, but may be surprised to find just how much you yourself will be teaching the medical students who rotate through the clinic. You will interact with third-year students who are completing their core clinic experience and fourth-year students performing their ambulatory care elective. As a resident physician, you might become the longitudinal mentor for a first or second-year medical student. Our nursing staff will occasionally have nursing students, and the medical office assistants precept medical office assistant students. Our clinic pharmacist regularly has pharmacy students. Our attendings have worked with nurse practitioner and physician assistant students and marriage and family therapy graduate students. We are proud of the fact that teaching is interwoven throughout our clinic at every possible level. I hope this gives you a taste of how our combined internal medicine pediatrics clinic operates. I do think it is a distinguishing feature of our residency program, and I'm glad that I had the opportunity to discuss it with you today.